Hey guys, it's Kathy. I just wanted to tell you all about a couple of resources that you may be interested in. First is the weekly newsletter called the FUMS Friday Night Six Pack. Goes out at 5 p.m. Eastern every Friday because it's 5 o'clock somewhere, right? It contains links to the top 6 happenings in the world of MS that week. Another great email list to sign up for, the Patients Getting Paid list. I'm working on an online course for those of us in the chronic community that either lost our jobs and need some flexible opportunities or that just want to supplement their existing income. Think being able to work from an infusion center or home or wherever and getting paid. If that sounds like something you might be interested in learning more about, sign up at FUMSnow.com/patients getting paid, and I'll let you know as soon as I launch that course. Thanks everybody, and FUMS. Welcome to the FUMS Now podcast show, where you'll gain information, inspiration, and motivation for living your best life with multiple sclerosis. Find us online at FUMSnow.com. I'm your host, Kathy Reagan Young. Today's guest is Mikhail Lewis, Vice President of Member Services at Pack Health, a digital health coaching platform for chronic disease management. They partner members with their own personal health advisor who provides weekly coaching sessions and personalized follow-up online and over the phone. These services are provided free of charge to the members, and the support provided can make all the difference in the world between surviving and thriving for people with chronic illness. Great news! Mikhail has brought something very special for FUMSers today. Let's go chat with her and learn more. Hi, Mikhail. Thanks so much for being with me here today.
Hi, Kathy. Thanks for having me. I'm excited to talk to you about Pack Health.
Yay! Well, I first heard of Pack Health through the wonderful savvy.coop site, and they had featured Pack Health's opportunity for free coaching for chronic conditions. And one of the people in my monthly FUMS Positivity Support Group meeting signed up, and she absolutely raves about how wonderful it's been for her and, you know, how helpful it is to have a coach help navigate through life and plan next steps and that sort of thing. And in particular, the accountability partner has been very helpful for her. It just sounds wonderful. So I really wanted to learn more, and I reached out. So if you would please give us an overview of what exactly Pack Health is.
Yes, definitely. So I wanted to first start with thanking Savvy Co-op for working with us. They're a great partner, and so shout out to them as well.
Yeah, great.
So Pack Health is a digital health coaching company, and I want to tell you about some things that Pack Health is, and then also I think it's helpful for some things Pack Health is not.
Great.
But we are a digital health coaching company, and we focus on changing behaviors, and we work with patients, and we actually call them members.
Mm-hmm.
So we work with members by partnering them with a health advisor, and the health advisor is there to deliver education, help them set goals, provide motivation, while also providing any care coordination. And so that might be like if you need to find a new doctor, or if you want a meal plan, or if you want an exercise plan. Your health advisor is there to deliver all those different kind of services. And the things that we don't do are, we're not going to give any clinical advice because all our health advisors don't have a clinical background, but they can help coordinate to get you an answer if you do have a question. Okay. But overall, our aim is to make sure that we're equipping members with the resources they need to live their healthiest, happiest lives. And that's through education, having a really personalized program, and then really working on behavior change through what we call tiny steps.
Oh, very cool. So what chronic conditions does Pack Health work with?
Yeah, so we have a very broad amount of chronic conditions that we work with. We have about 4 different therapeutic areas. So we have a cardio area where we work with type 2 diabetes, hypertension, high blood pressure, and diabetes prevention. And then for our immunology side, we work with patients with rheumatoid arthritis, multiple sclerosis, psoriasis, psoriatic arthritis. And then we actually have an oncology program as well. And that area is expanding for us. And right now we have a pain and fatigue program, as well as a breast cancer specific program. And then we kind of have a specialized area that is kind of a group of our other conditions. So it's like things like asthma, overactive bladder, and hepatitis C, which is actually not a chronic condition, but we do help patients as they're going through treatment. So it's a big amount. It's about over 25 chronic conditions.
Holy cow, that is a big amount.
Yes,
pretty far-reaching. Well, okay, so can you please walk me through the process from point of inquiry to sign up to actually working with a coach? What does that look like?
Yeah, so we try to limit the amount of barriers for this. So we want to make it really easy. And so there are many ways that you can sign up. You can sign up online through a landing page, which we'll talk more about later. And then you could call in. We have a call-in number that you'll be talked to an enrollment specialist, and they'll help you get enrolled. Or sometimes our patients will hear about us through their doctor, and their doctor will actually prescribe it. Which that's kind of a specific route. But again, we try to keep it very simple, really just collecting your name, your email, phone number, and address. If you don't have an email, that's okay. But we do collect a physical address so that we can actually send you a welcome pack in the mail. And so we do send you some tools at the beginning of the program as well. But yeah, it's pretty simple. We don't have any logins or usernames, and you just engage with your health coach like you would a friend or family member. Yeah. So through phone calls, texting, emails, and it's just someone that you can add to your contact list, and that is a part of your care team. And we actually match you with your health advisor right away when you enroll. So you get matched right away. That's
so cool. And I love that there's no additional username and password. I have enough of that in my life. Thank you very much.
I know. You're always trying to remember a password, and it's
ridiculous.
All these numbers and extra characters.
Yeah, I can't think. Well, okay, so that sounds great, but how is success measured? I read on your site, it said, quote, results include quality of life years added, higher satisfaction, better clinical outcomes, and lower total medical costs. Wow, those are pretty lofty goals to have attained. Can you speak to that a little bit?
They are, yes. And I know it's definitely lofty and it's a lot. But at the end of the day, what we're really working towards, every health advisor and everyone at PAC Health, whether you're a health advisor or not, we're working to make sure that our members are reaching their goals that they're setting. So in every program, we have a setting goals week where we talk to the member about setting a SMART goal. So at the end of the day, we really feel like we're successful when we're helping members and patients reach their goal. A lot of the things that we see due to the engagement that we do and due to the coaching that we provide is we do see reduced cost, whether for medical costs with our patients. We do see, quality of years added by some of the things that we collect. So we collect things on like physical and mental health. So we do see that improve. We see people getting more sleep. We see people taking their medications as prescribed, which all leads to better clinical outcomes. And maybe it's reduced flares, maybe it's reduced A1C, reduced weight, all those different things we do see as a result of our coaching. But at the end of the day, it's really all about making sure that we're helping the individual or the member reach their goal.
Very cool. Well, what type of subjects does the coach deal with?
That's a great question. So we actually have 10 core behaviors that we focus on for every program. And again, every program is personalized. So if there's something that the member wants to focus more on, of course, that's what we'll do. But we do focus on things like setting goals. That's definitely up there, number one. And then medication adherence. So taking your medications as prescribed, eating healthy, exercise, sleep, stress, and social support. Getting the right care, so making sure that you're utilizing your care team and you're able to navigate the healthcare system, and then also healthcare budgeting. So there is a financial aspect as well.
Wow.
Then we want to make sure that if there is a discount we can help you find, or if you're having trouble paying for something, that we can provide that, or it might be something related to meal planning. If we can help you get discounts for eating healthy or whatever it might be, those are kind of our 10 core behaviors that we really focus on.
That's fantastic. That is really wide-reaching.
Yes, it is.
It takes everything into consideration. Are there resources outside of PAC Health that the coach will recommend? I think you may have just alluded to that. So you were talking about, medication, reduction in medication costs and that sort of thing. And so I guess the answer to that question is yes, you do recommend things outside of PAC Health then.
We do, yes. We do have some partners that we work with. But we're not necessarily affiliated with anyone, if that makes sense. So we don't necessarily only recommend a certain service.
Yeah.
If you're telling us that you want a meal delivery service, then we look at all the options and what's best for you. Or if you need transportation, we also have a relationship with Uber. So it's not necessarily affiliated with one partner. We will do what's best for the member. So,
nice.
But yeah, we do have all those things that we're connected to, and we can help you navigate or get set up.
Wow, this is really all encompassing. So who are these coaches? What type of training do you require that they have, and how do you recruit them?
Yeah, so our health advisors are definitely a key piece in Pack Health, and that's something that we really pride ourselves in. We are a very person-driven and mission-driven company, and so our health advisors are extremely important, and we recruit locally from different campuses around, and then we also, of course, use like the standard recruiting services online. And then their training that they get is we do a 2-week intensive training in-house, and then they stay on our training team for 3 months where they're starting to specialize in certain areas. So if they're going to join the immunology team, then they really start focusing on those conditions that we offer for immunology. And then they also, after coaching for 1,000 hours, they actually sit for the International Consortium of Health and Wellness Coaching, and that is a national board exam. So we have ICHWC certified coaches that have taken that national standard as a test to become certified. And overall, the background of our health advisors, we have both male and female health advisors, and then different various backgrounds, but we always recruit from allied health professions. So it would be masters of social work, masters of public health. A lot of our health coaches, about, I think, 40% are master's prepared. And then they might be nutritionists, dietitians, exercise physiologists.
Wow.
So we've built a very diverse team because sometimes, your member might have a question where my specialty might not be healthy eating or nutrition. So I can go tap a nutritionist that's in-house to deliver that information back or get a question answered.
That is fantastic.
Yeah.
How long is I think you call them a pack, right? How long does the pack last? I mean, is it like a 6-week or 8-week program?
So our programs, the minimum length of a program is 12 weeks, so 3 months. But we actually have patients or members who have been working with us for 3 years. So it kind of just depends on your program that you're enrolled into, how it's being paid for, the funding. But typically, the least amount of a time for a program is 3 months.
Wow, that's fantastic. So this is free to chronic condition patients, right?
It is, yes. And
so how's that funded?
Yeah, so lots of different ways. We do grant work. So where we'll write a grant where we're looking at different things to, do publications. And so there'll be grant funded programs. We work with different groups, payer groups. So that might be insurance companies or even employers to offer this to their employees or to their people that are part of their membership for their insurance. And then we work with health systems as well. So they're funded through different entities, but a lot of the work is grant funded.
And always free to the member.
Yes, that's our main goal. We want to make sure it's always free to the member so that they can get the coaching they need.
That's wonderful. Is there an ultimate goal of having health insurance underwrite these services, or do you suspect that it will continue as you are with these various different funding mechanisms? No,
yes, we are in the process of doing that. Pack Health actually just recently we got provided, or we became a provider. So basically we were able to submit claims to an insurance company for the coaching services. So then that would be covered by your health insurance.
Oh, wow.
So yeah, we're in that process and very early stages, but that is definitely the ultimate goal.
That's the plan. Excellent. So if you would please talk a little bit about privacy, because I know that's, I'm sure, on a lot of people's minds. How protected are these coaching sessions?
Yeah, so of course, because it's health information and it is sensitive, we do pride ourselves in making sure that We are HIPAA compliant. So all the system that our health advisors use is HIPAA compliant. We are in a HIPAA secure environment. So all the calls are private. All we do record everything. That's really for safety purposes. But we do record everything, but nothing is shared externally with a group. And if it is shared, it's de-identified information. So no one would be able to know if a particular person was in a program, if that makes sense. Yeah. And all of that is available too. And in every enrollment page and in every pack, actually, there is a excerpt of our privacy in terms of use policy. So that's definitely accessible to anyone that's interested in, reading more about that. And we can always answer questions about that. But yeah, we definitely make sure that we're staying HIPAA compliant and, making sure we're not sharing any protective health information.
Excellent. Well, Mikhail, this has been such an interesting conversation. I've learned a ton about Pack Health and what you all have to offer. It sounds great. And speaking of which, I know you told me that you had some special news to share with the FUMS community. So go right ahead.
Yes, so we would love to offer 80 free programs to the FUMS community, and it's going to be a 3-month offering. So it's a free 12-week coaching program, and you can access that by going to packhealth.com/FUMS. And your promo code is already applied, so you'll just go in and enroll, and then you'll be assigned a health advisor.
Oh my gosh, that's fantastic. Thank you for that. And thank you so much for your time today and helping us to learn more about the opportunities available to us all at Pack Health. Thank you for the 80 packs for the FUMS community. That's great. I look forward to hearing from everybody when you get signed up. Let me know. I want to hear how it goes for everybody. I literally just signed up myself about an hour ago, and it was super easy, quick, no-brainer. Loved the no username, no password. Who needs any more of those? So anyway, Mikhail, we really appreciate it. So what's the best way for people to learn more or to get signed up? Is it all that same packhealth.com/FUMS?
Yes, that's definitely the quickest way to get signed up. We also are on all social media platforms. So that's Facebook. We actually have a private group that once you become a member, you'll get that information to get signed up for our private Facebook group. We have a Twitter, Instagram, LinkedIn, YouTube. We have all the socials.
Got them covered.
Yes, so we got it all covered. And we actually also have a Pack Health blog. So that's packhealth.com/blog.
Oh, very cool.
Yeah.
And just to remind everybody, you don't have to pull over and write all this stuff down. I take the notes for you. It'll be in the show notes. All of these links will be in the show notes. So anyway, well, again, Mikhail, thank you so much for your time and for bringing us these wonderful packs. And I look forward to hearing everybody's great results with Pack Health.
Thanks, Kathy.
Thanks, everybody. I really appreciate you listening to the FUMS podcast show. Be sure to subscribe to it so you won't miss an episode. You can do that right on the website at FUMSnow.com. While you're there, sign up for the free email list so you'll be among the first to know of any new findings in MS research, new therapies and products, as well as any blog posts and podcast episodes I release. Want to chat with others in the FUMS community? Join us on Facebook at FUMS Now. Thanks again, and don't forget to talk to the stupid disease as it deserves. Tell it FUMS every day.